So, would my panelists like to join me on stage, please, so, so we can talk about knowledge and technology transfer? Of course, the primary mission, as we all know, of CERN was fundamental physics, but we've already been hearing about the applications that are really bringing about all sorts of changes in our lives. It can be in medicine, in IT, even in art, as we'll be hearing. And researchers from Belgium have played a really key role in this, and so we're going to discuss now. We're joined by Serge Mathot at the end, who's an applied physicist actually working at CERN, but formerly from the University of Namur. Serge Goldman, not everybody's called Serge on this panel, but just two of them. Serge Goldman, former head of the Department of Nuclear Medicine at ULB, Erasmus Hospital, and you're the Belgian delegate to the CERN Knowledge Transfer Forum on Medical Applications. Then we have Pierre Van Mechelen, Professor of Physics at the University of Antwerp, and Thomas Cocolios, who is Professor of Physics at KU Leuven, and a member of CERN's Knowledge Transfer Forum. So, Thomas, let's define what we mean by both knowledge and technology transfer.
Yeah, well, thank you for this panel. It's indeed a very important aspect as well of what CERN is bringing. There are several aspects to knowledge and technology transfer. There is first the idea of CERN finding things themselves that they want to bring to the world, and we call that technology push, developments that come from within. Then you have external people who can find at CERN answers to their questions and to their needs, and they ask CERN for help. We call that the technology pool, where they can really get knowledge out of CERN. And finally, there is serendipity, the things that happen at CERN and turn out to change the world. And we've heard already the World Wide Web, how it came about in the original video at the start of today. And I think that's one of the best examples of unexpected consequences.
Well, we'll try and pick up on some of that push and pull and serendipity as we go through. So that's sort of tech transfer. What about actual knowledge transfer, Pierre Van Mechelen, in terms of what it means? We've heard how people, PhD students, and just go there, and that's this wow factor. And Fabiola talked about people learning so much from just being part of the CERN experience. Tell us more about that.
Yes, so as you know, Belgium has been a member of CERN from the very beginning, and so I've been sending PhD students, engineers, and postdocs to CERN for a very long time. And there, I mean, of course, it's a fantastic environment to work in. And they don't only learn about some esoteric physics topics, but also they get very practical skills about detector building, analysis of big data, computing, grid computing, or artificial intelligence. And afterwards, they take these skills back to society. So what they get trained at CERN, they take back to the society, and which is very beneficial to society at large, I think.
So that's we've got the technology transfer and the knowledge transfer. Let's look at an example then of a technology that CERN was working on that has really got sort of amazing potential, and that's nuclear waste disposal. And Serge Mathot, perhaps you can tell us some more about this, because CERN was working using accelerators to control nuclear reactors, I think, and saw the potential for the disposal of nuclear waste, and is now working in Belgium with, collaborating here.
Yes, this is working now in Belgium, the initial idea from CERN, from Carlo Rubbia. And in Belgium we have the chance to have this new institute now, MIRA, to develop a linear accelerator for the treatments of the nuclear waste. So this is a very great potential of application of accelerator.
But so what is the science behind it then? I mean, we think of nuclear waste as being something that just is there for all eternity. I mean,
yes, it's there for all eternity if we do nothing. But it's possible to transmute, in fact, to modify this isotope and to transform like an internal isotope, an isotope of very long lifetime with a short lifetime, then we can dispose more easily. That's the goal of this strategy, to solve the problem of the nuclear waste.
So does,
in an interesting way, it relates to what Gheorghe was talking about earlier, how at CERN we produce a lot of isotopes by shooting the protons on some material, but in the same way you can induce those nuclear reactions on the waste to destroy them and turn them into other isotopes that are so much shorter lived that they can decay within a few hundred years, a time scale that we as humans can understand and control to make them at the end not more radioactive than what we extracted from the soil to begin with.
Yeah.
I think there's a lesson to be learned here. Because as you say, people thought nuclear waste is hopeless. It's there for eternity. It's nothing that we can do about. But then if you ask a scientist, they will tell you, but the radioactive nucleus is something very fragile. It wants to decay. It just needs a little nudge, so let's fire a beam at it. And so scientists can come up with solutions. Now we are faced with climate change, which is a very important problem. And again, people think, we're doomed, it's hopeless. But we have to rely on scientists and on knowledge and technology transfer to solve these problems and to also to mitigate these problems.
And we've certainly seen in the medical field, haven't we, Serge Goldman, how radioactive isotopes have long been used, but this is a developing field, developing so quickly. Tell us some more about that.
Yes, that's an interesting point. The fact that very early after the discovery of radioactivity, of radiation in general, of nuclear physics in a certain way, people were looking at medical application, because if we like beauty, we also like life. And obviously any discovery can have some application in health. And so it's true that isotopes known for a very long time have been used in medical application, but the fact that at CERN, and Gerda explained, the fact that you are playing with exotic isotopes open new perspectives in the way you can apply isotopes to treat cancer, for instance.
I mean, for instance, patients in Belgium, how would we be benefiting potentially from this work?
Certainly, Belgian citizens are benefiting from these new isotopes. It's probably true for any European citizen in general. But it's true that nuclear medicine and radiation therapy are extremely developed in Belgium. It's probably a historical process that led to this. And so certainly Belgian citizens will benefit probably better than any other citizens in Europe.
Yeah, I think an evidence of that is through the Medicis facility that has been built on the backbone of Isolde that Gerda mentioned. You've seen the chaos of that lab and the number of experiments. They go through 50 different configurations in a year. There is no way to sustain medical research through that. But CERN actually invested massively into building a parallel facility behind it that is dedicated to medical isotopes, the medical isotopes collected from Isolde. And Belgium was one of the founding partners. My colleague Pierre Van Mechelen stood with a shovel next to the Director General for the groundbreaking, and we contributed also with material from Louvain-la-Neuve, sending the dipole magnet that was needed for the separator and so on. But in return, the developments have been also fast-tracked towards a sister facility that we are designing in the Belgian Nuclear Research Center, CKCEN, where the MIRA project will be located, so that it would not only do waste transmutation, but it can also be used for medical radionuclide production in the reactor, as is done already over there in the existing Belgian reactor 2, but also applying the ISOL technique that has been developed and perfectioned with Isolde and Medicis in the ISOL at MIRA facility. And there is a very strong connection there where regularly our students, our technicians from Belgium go to CERN to learn. I have one of them right now calling me every day, telling me how excited he is to learn from over there. And we've developed a really strong partnership where today we can produce radioactivity in Belgian reactor 2, bring it to CERN, separate it, and get it to the necessary quality and purity to make it a medical grade isotopes for research. And there are even discussions that maybe this should be brought to the clinical level soon. So, you know, the research takes a long time in that field. but we are coming there.
Massive potential.
Absolutely.
Very interesting. Now, let's talk about compact accelerators now, because we know that the Hadron Collider is the largest in the world, but there are now portable proton accelerators. And Serge Mathot, I know you've been involved in developing these so-called pocket accelerators. They've been used in the treatment of cancer, but also, actually, what is interesting is they're used also to analyze and authenticate works of art.
Yes, exactly. But to start with the beginning, I want to explain that we developed the technology of construction of what we call an RFQ. It's a radio frequency quadrupole. It's a special accelerating cavity that we need at the beginning of the LHC. So we developed at CERN a process of constructing, for the construction of this very delicate accelerating cavity. And in fact, with this experience, we were able to build a smallest model, I would say, of this cavity, very useful for the treatment of cancer by hadron therapy, so for a medical accelerator to accelerate proton and to irradiate cancer.
And when we talk about small, how small are we talking?
That was the second step. After this medical application, we decided to build, again, the smallest one for the analysis of material, effectively, when we accelerate proton at a very modest energy, 2 MeV, which is nothing comparable with the LHC. But at this energy, we can irradiate a material, and collect the X-ray produced during these irradiations, and analyze, determine the composition of these materials. And this is very efficient. It's not really a nuclear technique. It's based on a proton beam. This is absolutely non-destructive because the beam is very low in intensity, in energy. So we cannot destroy the material. This is a very well-known technique used at the Museum Le Louvre, for example. They have an accelerator there. The new development we made is to have a portable, as you say, pocket. It's more portable, is more used than pocket.
Yes, it's not really a pocket. That's perhaps a slight exaggeration.
Transportable accelerators to go in museum now with the accelerator and to analyze the precious piece they have there.
Amazing, amazing. Now, let's talk about the whole open science concept, because all the developments at CERN are free, available to anybody. There was no patent on the World Wide Web, for instance. So can private companies just come to CERN and say, hey, we've got a problem, help? Or, you know, how is it controlled? Because potentially this could fall into the wrong hands. How is it organized?
Yes, this happened with example with this accelerator. We have company coming at CERN and say, can you help us to build, or how to explain how to build an accelerator for this application, for treatment of cancer, for example. But we have a system of patent at CERN. This is very well defined. So CERN will pay for a patent if the application is an industrial application. If we can find, how to say, an industrial application of what we discover. That was the case for this compact accelerator. We have a patent on this because we have potential industrialization of the construction of this kind of accelerator. But this is only in that case that we have royalties and patents. Yeah.
And there is a licensing approach, though, isn't there?
Yes, indeed. CERN has, in the recent years, dedicated a lot of attention to formalizing its knowledge transfer and opening all sorts of different paths. So there is patenting, that's one way. There is the idea also of licensing, forming collaborations where you've developed something. Medipix is such an example, where they developed very powerful chips for imaging and analysis. And those can be licensed to different companies, and we find them now in toolkits for students. We find them in medical imaging and in all sorts of applications throughout member states. And then those companies just request it and then are allowed to use them and apply them, always in the spirit of how CERN was built, which is science for peace, which is really at the core of the CERN Treaty, of its foundation. And so that's also how we regulate it. But there are also other approaches, just in form of consulting or in form of co-development of contract research that can be done at CERN, always with the same spirit. And then finally, as we've seen in the video just before this panel, the new CERN Venture project, which is really meant to support spin-offs and boost starting companies. And then there is a new idea that also is being developed. Those are the innovation hubs, where CERN will try to implant itself in the different member states to really bring its knowledge and its technology closer to where the needs are. And there are discussions ongoing at the moment to start that here in Belgium, in Hasselt, together with Bioville and Energieville.
And Pierre, I mean, you see companies like Google coming through the doors at CERN. I mean, what do they want? What are they doing?
That's a beautiful example. I'm also on the CMS experiment, although this is wider than CMS only. But in 2022, Eric Schmidt, the former CEO of Google, came to visit CERN, and he was very impressed with what we are doing there. So he decided to invest, I think, about 50 million euros of Swiss francs in a project to use artificial intelligence to select events online, real time. So we have to be very fast in our event selection. Now, of course, this has very good applications, also, for instance, in the finance world, where you want to spot anomalies on the stock market in real time. So it just shows that yes, even non-physicists are very interested in what we do and are very much aware that the applications we provide can be very useful.
And Serge Goldman, in the medical world, we talked about the push and pull effect. I mean, do medical people go to CERN and say, hey, we've got this problem, help?
I think you have situations which are in both directions. For instance, CERN has decided with the Medicis project to externalize something that has been developed over there. But at the same time, because they collaborate with a lot of academic centers around the world, mainly in Europe, there are questions that are sent to CERN and that they try to answer to. So I think that there's not one direction that should be considered in that situation. And also, I would like to mention that we have discussed mainly about technology transfer, but I think that the most important aspect is the knowledge transfer. That is the introduction of this particular culture based on fundamental research that is put inside industrial efforts that we see in Europe. And that is, I think, the main benefit of CERN in terms of transfer is the fact that they have this distant view about a target, and a target that may be a particular development that we would like to have. And this very particular view is essential to lead to creative and innovative inventions. I think that's the main thing.
Hugely important. Well, thank you very much, and thank you all very much indeed. All very inspiring stuff. And here is to the next 70 years. Thank you very much.